So the right lobe of the lung, there are the cranial lobe, the middle lobe, the caudal lobe, and the accessory lobe that is not in there, right? The accessory lobe is something, a groove for the caudal vena cava. The diaphragmatic surfaces on the accessory lobe and the caudal lobe.
Cardiac notch.
Yeah, the cardiac notch in between the cranial and medial lobe. I think that's it for the most part for the lungs. Oh, there's the base and the apex.
Base. Apex.
Need the tracheobronchial lymph nodes.
Which there's a bunch of them, and as long as they're in that general area.
They're down here, but you can't really see them. You have to
So
palpate
near
them.
the diaphragm, kind of under the esophagus.
And then the thymus gland. And that's above the heart. That has dropped.
Yeah.
Now it says she needs to go to the other side.
Just go ahead.
Okay. And the left common carotid artery.
It's upside down view. That's the common carotid.
Oh,
Common carotid.
this one. Not that part, but this part.
This part.
Up in the neck.
The vagosympathetic trunk, which runs next to it. The left subclavian artery.
That's this one.
The aortic arch.
Right here.
Which is what?
So the subclavian is branching off.
The ansa subclavian. That's the ring around the subclavian.
Right here.
The cervicothoracic ganglion. Which is the bundle in between, right? The middle cervical ganglion, which was on the other
This
side.
one.
Yep. And then he also showed us the vagus nerve coming out of that, which ours is cut. And then the left recurrent laryngeal nerve, which is there and goes into the heart.
And then, where's the other?
Yeah. Okay, the dorsal vagal trunk. You showed us where it branched in the back.
So, this is the dorsal
And then the ventral.
and the ventral.
The sympathetic trunk, which was the thin one that went down. And then the sympathetic trunk ganglia, which were the little bulbs. And then look, he rolls over.
Come right out of the or the, what are they called? The whole
Intervertebral form.
intervertebral form.
And we look for the azygous vein.
Which is the blue one, or the obviously the vein that runs up along
It
the
ends in the
spine.
cranial vena cava.
It's kind of hard to see because we took the latex out.
And the heart.
This right here.
Okay.
Which that goes right into the right atrium.
Then we have the right subclavian artery.
I know we were talking about the nerve, the vertebral nerve or something.
The right common carotid artery. The right vagosympathetic trunk. And right vagus nerve. Vagus.
Right vagus nerve.
Okay. Then we're going to the internal thoracic artery.
Branches and comes down along
The front part of the sternum. The superficial cervical artery. Which is the one that comes to the front. That was cut. The vertebral artery.
which runs to
Which was
the
the bottom one. And the costocervical trunk, which was the other one. Okay. And then the sternal lymph nodes.
right of the sternum.
Some here. There's one there.
I think they got pulled around with the
Yeah.
Yeah, but they're on.
There's another one.
Okay.
There's one.
Cranial mediastinal lymph nodes are just kind of all in the goo.
Yeah, let's see if there's one here somewhere. There's one. Yeah, that's one right there.
Okay. The vertebral nerve traveling alongside the vertebral artery.
So a nerve, it's running next to that artery.
The brachiocephalic trunk. This is that whole thing, right? It was deeper.
Yeah.
Brachiocephalic trunk.
Subclavian is coming off of that, right? So here's this.
The internal thoracic vein. The vertebral vein.
Which runs right over the.
And it runs into the costocervical vein, which runs into the cranial vena cava. Okay. Then you have your right external jugular vein. That branches from there.
Subclavian, external jugular.
Okay, then we're going to the pleura of the heart. Ligamentum arteriosum. In the fetus, it's known as the ductus arteriosus. All right, the right ventricle. The left ventricle. The terminal portion of the right ventricle prior to the pulmonary trunk is the conus arteriosus. Right in
Here.
the right and left.
Conus arteriosus.
Try. The right and left atria have the right and left auricles. So those are those protrusions.
Left, right.
Okay. The peritoneal interventricular branch of the left coronary artery.
What's that? This one?
You're a stupid organ.
Peritoneal interventricular groove is where that lies.
It's right here.
Okay. The circumflex branch of the left coronary artery. And that's in the coronary groove.
So, and here?
There's the ascending aorta, which is the one that goes toward the head, right?
The aorta here.
Isn't that the descending though? And the ascending would be the one coming out of the heart.
Yeah.
Subsinusal interventricular branch of the left coronary artery. And the subsinusal interventricular groove.
Did we find that one?
That's what we were supposed to. I think that was one.
Yeah.
Please see textbook. Figure 3.25. All right, the right coronary artery.
Oh, we can just
Yeah, we're back on the other side.
Okay.
The right coronary artery.
I just want to cut the. Oh, it's that one.
The sinus venerum cavarum, which is the largest cavity of the right atrium.
This portion here.
The pectinate muscles. The coronary sinus.
And that's the little.
Right here. Okay. The interarterial septum.
Oh, septum,
Yeah.
that's right.
It's right here.
Intravenous tubercle. The fossa ovalis, which is the foramen ovale in fetus. Then you have the right atrioventricular orifice and the right atrioventricular valve.
Which you didn't get to
This
that,
is
right?
the orifice right here, and then the valve is this.
Okay. Now we're going to go back to right lateral recumbency. The colonic valve of the right ventricle.
That's the valve right there.
The chordae tendineae.
There's a little hole there. It's kind of hard to see it on the camera.
And how they connect to the papillary muscles. Okay. Trabeculae carnae.
That's this part here. It stretches.
Okay. The interventricular septum.
Right here.
Well, in between the ventricles.
The trabecula septomarginalis.
Which is thinner than the.
The left atrioventricular orifice and the left atrioventricular valve.
It's right here. And
And
this is the edge of the valve.
the aortic valve.
Oh, those aren't ones that we don't do.
Oh, okay. And that's all.